Assessing if you need in-home care. Dressing. The topic of dressing can be overcome with a number of mobility aids, provided that you have the use of your two arms to manipulate the mobility aids. Before I get into the topic and the specific logistics of dressing, I want to share with you that I've relied on help changing my clothes. I personally am comfortable with my body. The specific reason is because of having multiple surgeries and the extreme loss of privacy that occurs in a hospital. It may be more of a struggle for some people. What may help you is realizing that the person is there to be of help to you, and there's only a short while that it take for you to get underwear on and a bra if you're a woman to cover your private areas. I also want to share with you that when I needed help getting myself dressed, I was between 33 and 36 years old. It's young to be needing this help, but if it means that you gain your independence, I feel that the trade-off is worth it. At the time I was especially dependent on this service, I didn't have the ability to use the tools to dress myself. So I want to let you know what's available. It starts with the question of, do you have the ability to use your arms to dress your upper body independently? So I'm specifically thinking if a shoulder either has maybe a vascular necrosis in it, or maybe it's got arthritis in it and you can't freely move it, lifting and bending's hard. It's going to be challenging for you to dress yourself without the motion of your arms. It is possible to do if you've experienced an arm amputation and only have one arm to work with, but it means developing having patience to do the tasks associated with dressing. Using a reacher grabber will work for underwear, shorts, or jogging pants and pants. So a reacher grabber is like making your arm another 2 feet longer. It's very helpful in dressing the lower half of your body. An occupational therapist would take you through the steps of putting on underwear and jogging pants or shorts using a reacher grabber if you ask for this help. If you're planning surgery, I would encourage you to practice dressing yourself with a reacher grabber before the operation so that you have the patience to carry out the task of this while you're healing from the surgery. I'm basically saying it's kind of like riding a bike. If you've got it in your head that you know how to do it, it won't be frustrating to work through the motion of dressing while you're weak from whatever surgery was necessary. Once the clothing is on, either jogging pants or shorts or dress pants for all that matters, a long handle sock horn is able to be used to put on your socks. If you haven't seen one before, a sock horn is like a U shape where the sock is put on it initially, and then kind of like a glove, your foot goes into it and the sock stays on your foot as you put your foot through and pull the sock horn up towards your body. It leaves the sock on your foot when you've completed the chain of events, and then any little adjustments needed are done with the reacher grabber if it needs slightly bending or turning. This is another skill, it takes some practice. It also needs socks that are compatible with whatever model you use. Some are plastic, some have fabric on them. You'll find what slips on and lets your foot slip through it the best, as well as what's your best option for keeping it clean from grease and dirt that may be building up on the bottom of your feet. The final area of dressing is using shoes. There's a few tips that I have for you. So a long handle shoe horn will help you get your shoes on. If it is that you can't bend, whether it's a temporary situation such as following a hip replacement surgery or it's permanent, you could elect for shoes that have Velcro laces and then using a reacher grabber to put the Velcro in place to keep the shoe on your foot. This is one of the strategies I employed to maximize my independence. Velcro laces aren't common in adult shoes, but if that is your need, it is available, and someone who sells orthotics or arch supports could go ahead and help you locate a pair. You may end up spending a little bit more money, but if it means improved independence, I think for the peace of mind that it's worth it.